Your phone buzzes. Your clinician says, "We found a clinical trial that might help." Your heart skips a beat. Hope and worry at once. Is it safe? Placebo? Who pays? You're not alone. I hear these questions in clinic every week.
Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Let's separate medical fact from fiction and give you clear, usable steps so you can decide with confidence. Quick housekeeping. This episode is informational and not individualized medical advice. Talk with your clinician about your personal risks before enrolling. All right, let's make this simple and practical. At its simplest, a clinical trial asks one question about a medical approach. Is it safe? Does it help? How should it be used? Think of it as careful testing with rules, so we act on evidence, not guesswork. A few plain words that matter. An intervention is what's being tested. A drug, a device, or even a care strategy. A control is the comparison group, sometimes standard care, sometimes a placebo. Blinding means people don't know who got what, which helps the results stay honest.
Now, trials move in phases. I'll keep each one short so it sticks. Phase 1. Safety and dosing. Small groups, close monitoring. Phase 2. Early signs of effect. Does it seem to work at a safe dose? Phase 3. Large comparison against standard care. This is often the study that changes practice. Phase 4. After approval, we keep watching for rare or long-term effects. Together, the phases move from uncertainty to clearer answers. Quick example. Imagine a new arthritis pill. Phase 2 might show pain improves, but Phase 3 asks if it prevents joint damage or increases other risks when compared to standard therapy. That's the difference between a hopeful sign and practice-changing evidence. Safety is layered. Independent ethics committees, called IRBs, review the protocol before it starts. Large studies often have data safety monitoring boards who read the data as the trial runs and can pause it if needed. Adverse events get reported formally. That's how the system detects problems early. Important reality. Oversight reduces risk but does not remove it. Your job is to understand the monitoring plan and be clear about how quickly the team responds to side effects. Informed consent is a conversation, not just a signature. The form should explain purpose, procedures, risks and benefits, alternatives, and your rights, including the right to withdraw at any time without penalty.
Red flags inside consent forms. Language suggesting you waive legal rights. Promises of guaranteed benefit. Or pressure to sign immediately. If anything sounds like coercion or confusion, pause and ask for plain language explanations.
Money is a common worry. Often the study covers the experimental drug. Routine care usually bills insurance. Travel or time off reimbursements vary. If compensation looks unusually large, ask why. It shouldn't be so big that it feels like pressure to enroll. Let me give you a short vignette to make trade-offs concrete. A 62-year-old with severe arthritis joined a Phase 2 study and felt relief early on. Later, researchers saw a heart safety signal and adjusted dosing in subsequent trials. Her participation helped identify that risk, which protected future patients. But it also meant she faced unexpected monitoring. Real outcomes vary, and that's why clear expectations matter.
When you talk to the research team, use direct, targeted questions. Here are 2 short scripts you can read or adapt.
Can you walk me through a typical visit and tell me who I call after hours for side effects? How many people have enrolled and what side effects have you seen so far? Script for your clinician. Can you review this protocol with me? Here's the consent. What stands out as risky or promising for my situation? Bring both the protocol and the consent. Clinical context changes the calculus.
Okay, practical checklist you can jot down. I'll say each item in a short, punchy line so you can keep up.
1. Purpose and phase. What exactly are they testing? 2. Safety monitoring. Who watches and how do I reach them after hours? 3. Risks versus benefits. Realistic expectations and likely timelines. 4. Costs and compensation. What's covered, what's billed to insurance. 5. Logistics. Time, travel, extra tests. 6. Withdrawal. How to stop and what happens next.
A couple of final quick tips. Look up the study on clinicaltrials.gov to see sponsor and basic design. Ask whether there are published results for related studies, and if consent language suggests giving up rights, get clarification or legal advice.
Before we close, 3 clear takeaways to remember. 1. Informed consent is a process. Don't sign until you understand monitoring and emergency contacts. 2. Ask concrete logistical questions now. Those avoid real headaches later. 3. Bring the protocol and consent to your clinician or a trusted advocate and get a second opinion.
Thanks for spending this time with me. If this episode helped clarify clinical trials for you, please share it and subscribe so more patients and families get accurate, practical information. Download the episode checklist at faqbynursejessicaconsulting.com/resources and bring it to your next conversation with a research team or clinician. I'm Jess, a family nurse practitioner and legal nurse consultant. Until next time, stay informed, stay compassionate, and always put safety first.